patient. Again, it's gonna come with this cap. You're gonna put that out of the way so it does not get contaminated. You're going to put on the disposable cover, disposable applicator, syringe type. You're gonna drop it into the syringe barrier and look for the little slit. And then now we can use that and it won't get contaminated, okay? When you're done, you just push it back a little bit, you hold it, you twist that off, and I drop that onto a clean area so that that way that syringe never got contaminated. We don't need to disinfect it, don't need to do anything to it, okay? And then this could all get discarded. These are kind of sharp, so it's probably not a bad idea to put these in the sharps container. Now, when you're using the acid etch in the procedure, you can use it, the operator might choose to use it right from the syringe, and they can inject it right into the area, okay, which is what we'll have you do when you're doing sealants. Or if they want to use a well, you would inject it into spot 1, or dispense it into spot 1, and then you could take that off the tray so it doesn't get contaminated, okay? I have not touched the patient yet, so I am not yet contaminated either. And then your bonding needs to be dispensed, so that's gonna go right into spot 2 in the well. So I'm going to open that. And put a drop in there. That is light sensitive, so you wanna make sure you cover that. Put that off to the side so it doesn't get disinfected. And then my composite. So remember, they can take the composite and go right into the gun, right into the mouth with the gun, and dispense it right into the prep. They can use the condensable composite in the syringe, and you would take what you need and dispense into the well that way. So it's going to go right into spot 3. And then you're just gonna close that. So that it's not exposed to the light. And then this can get covered and dispensed. If they wanna use these, they could put this right into the well. And then if they're using the flowable composite, you're gonna do the same thing that you did with the acid etch. Make sure your curing light is charged and you can take that out. And then I need the alcohol out, so I'm gonna open that up because I'm gonna need the alcohol 2x2. You can try and set that out ahead of time, but I would leave this out because often we know that alcohol will evaporate pretty quickly, so sometimes it evaporates prior to using it, okay? So, first thing we're gonna do before we contaminate ourselves is to get a shade, so I'll hold this near the mouth and the dentist is going to pick a shade. So we'll take that one out. You always want to leave that out, and I'm gonna put this off to the side. You wanna leave that out in case they forget. So if you just got the shade and you left it in and put it away, then halfway through the procedure, you could be saying, what shade did we pick again? So you wanna make sure you leave that out somewhere. So you can leave it here, you can leave it off to the side, and make sure you do have that shade there. We picked A2, so we would get our A2 composite, and that's what we would dispense, okay? We always start with a mirror and explorer. And then we're gonna get ready to do our topical. We're gonna go underneath the patient's chin.
Are hygienists allowed to administer anesthesia?
They need a separate anesthesia license called an L permit.
Okay.
So some can, some cannot. It depends if they have the separate license. So it's a separate written board exam. And if they were trained in school prior to that being taught, they have to do the course and then pass the exam. So then we're going to place the slide rejector. Oh, Darius, can you turn on the,
Compressor.
yes, thank you. We're gonna place the slide rejector on the opposite side that we're working.
We would have the light, remember.
Thank you. So we're working the anterior. She's gonna start on the lingual, so I'm gonna be in 10 grafts on the facial. And I have my air water syringe so I can put air and water on her mirror. Especially when she's working like that, this mirror is gonna tend to get dirty. So I have air unless I see it getting dirty, and then I'll rinse with water and then go to air. She's coming to the facial, so I'm gonna go lingual. Is the water on?
Barely. I think that's why we got stuff all over us. I think that's fine,
So we're gonna check with the Explorer to see if we're down to the decay. Good. So I'm going to pass a spoon. Oh,
oh, the spoon's, yes. the
spoon, yep, to remove the
sorry.
decay.
My bad.
And I have my 2x2 to get that. And then she's going to check to confirm that we're down to the decay.
Good.
And then I'm going to get that long thin diamond burr. I'm going to hold it by the end that needs to go into the handpiece. She's going to grab the working end so she can put it right in. I'm going to get my HDE in the three-way again. And now she's going to create the bevels with that. So the bevels, again, are what's gonna make that blend a little bit better so that to the naked eye, we don't see that margin of where the tube stops and the composite starts. And now we're doing a mesial restoration, so I'm going to pass the mesial margin trimmer. And then I'm gonna follow that with the Explorer. Good. All set?
All set.
And then we're going to rinse and dry. So the rinse and dry now you'll be doing. So you want to make sure you get right underneath the prep. I'm going to spray with water right in to rinse that, and then do a white dry. All right, now we're going to isolate with cotton rolls. So I'm going to bend that for her since it's in the anterior. Since it's the maxillary anterior, we don't need to place the lingual cotton roll. And then I'm going to pass her the cellular matrix. And then my wedge.
I don't know why my hands don't work.
Down his throat.
And then now we're going to acid etch. So remember, they could syringe the acid etch in, or they can do it this way, and you want to make sure you close this right over so that the overhead light doesn't affect it. Excuse me, we're going to leave that on for 15 seconds. And then I'm going to rinse. Now, once the time is up here, this is when it's really critical to make sure you know which button is water and which is air. Where is the water?
On the right.
Left.
Yeah.
So water on the left, remember air to the right means to be cautious. If you tell someone to air to the right, it means to be cautious. So water on the left. So I want to go in there with water only, because if I go in there with air, I can blow this etch all around, okay? It could get on either one of us, it could get on the patient. It actually did happen to one of the instructors that works in the high school program there. Okay, so you wanna go right underneath, remember, we don't want this to touch the mucosa, and I'm gonna go right over, and I'm going to do just water until I can see that most of that etching is gone. And then if I need to, I can do the car wash, right, the air and water combination. But you wanna make sure that all that etching is washed away, and then I'm going to wipe dry. Why is it so important at that part, after I've etched, to make sure I wipe dry?
So that, it bonds correctly? Cause didn't you say like if it's still wet, it doesn't stay?
Yep, but why would I wipe dry rather than blast the air? Right over
But you don't
those-
want it completely dry.
Right, well, there's dentinal tubules that are all open and exposed now because I just acid etched them.
Hypersensitivity.
Right, so if we go right over and we blow air on those, we can desiccate them or over dry them, causing postoperative sensitivity to the patient. So you wanna do the wipe dry, meaning that you do straight air and you fan it back and forth as opposed to that, okay? Now we're going to bond, so I'm gonna get the little micro brush. And then I'm gonna hold that open, so she's gonna take from spot 2, which is the bond. This is also again called the unfilled resin, and we're going to cure that. So we're gonna make sure that our patient has his glasses on. I have the shield, and we're gonna cure for 15 seconds. I'm sorry, 20 seconds.
Are we not supposed to look directly at it?
Don't look directly at it.
I looked
I
right
don't
at it.
like, I looked right, I was too, my eyes, I just felt like my corneas
Yeah.
burned.
And you
Just
wanna
singed
make
my
sure that
eyes.
your curing light is over the area where you're working, that it's not like, you know, over another tooth. It should be right over the spot where you displaced that. And you can see that it stopped. Again, I'm gonna put that down off the tray so it doesn't get too contaminated. I can put that back there. And now I'm gonna give her, so we could be placing this way if she preferred to. We could be using the flowable with the syringe. She's going to place with a plastic instrument, a condensable. And then I'm going to have my alcohol 2x2, it actually did stay wet enough that time. I have my alcohol 2x2 in my right hand, ready to wipe her instrument, cause it's gonna be sticky.
And that's why you're using the alcohol, just 'cause it's gonna be
Cause it's sticky, yep. So she can use that sometimes if the, composite's sticking to it, she'll wipe the instrument with the alcohol.
You said she was using a plastic instrument?
That's what that's called, a plastic instrument, yep.
Sometimes you might see the dentist using any leftover bonding to,
Yep, they'll dip into the bond to make it less sticky also. And then now we're gonna get ready to cure. I'm gonna wipe this off. And that's the filled resin, so our bond was the unfilled resin. The composite is the filled resin. And now I'm gonna cure from the facial and from the lingual. Okay, so this is gonna be 30 seconds all surfaces. So 30 seconds from the facial, and then I'm gonna go to the lingual for 30 seconds. Remember that if this was a really deep prep, they could cure in increments.
So the light shuts off after.
Yep, so there's a
20 seconds.
timer. There's a timer on it, so you set it for how long you need it for, yeah. And then you just wanna make sure you're over the area where.
Is it beeping or am I hearing
It
things?
is, yeah.
Okay, I'm like,
So it tells you right here, there's a screen, so that's for 20 seconds, so you can change the setting with the button, okay? And that's gonna be disinfected after. So now we are going to check the bite. Now, would we really need to check the bite with this, oh, sorry, we need to remove the wedges first. We're gonna remove the wedges and
So I know for the other matrix bands we use, they go into sharps. The cellular one, is that one just disposed of
Yeah, that's the
regularly?
regular trash. So if this is wet, so we didn't need to wet it. If it was dry, remember, she would secure it, I would wet it. Okay? And after you rinse the acid etch, you would check your cotton roll. If your cotton roll looks wet after you rinse the etching away, you would replace it so that you didn't get any water contamination, okay? Now, this is, you're gonna remove your slide rejector. This is not an incisal, right? It's not a class 4, so technically this one we wouldn't need to check the bite, but we're going to have you do it so you know to do that as part of the procedure.
Broke his jaw.
And then we're going to start with the finishing disc. So we already pre-set up for her
Oh,
the
geez,
darker.
sorry.
You're good.
I wasn't looking up.
You almost took her head off her body.
And then now you're going to put small drips of water, which is probably one of the trickier things to do. With just the right amount of pressure, we're just gonna drip water under the tube so it doesn't create too much frictional heat.
So what, you would just barely press down on the button?
Yep. And it's not as easy as it looks. Like you'll go and all of a sudden you're
It'll like shoot out.
yeah. It's like just the right amount of pressure. So she's working from dark to light. So you can see we have those on the 2x2 with the color side up so that she can see.
Is there a certain amount of discs that you have to use? Oh,
With this, so it depends on the system. With this, it's the 4.
okay.
How do you know when it's time to switch the disc?
The operator does, so they're looking for the smoothness, just like when you did the denture polishing.
Okay.
So they're looking for each time for it to get more polishable.
And
This
so
is
like,
actually a great shade. No, not a bad
I know,
shade.
this one looks good.
and so with like the dental polishing, if you have to start over, do you just?
Yes,
go
you'd
from-
have to go all the way back again, just like with that. Yep. So we'll put the remaining strips here. Now I'm going to get the finishing strip. And then I'm going to get the floss ready. The floss should be set up just like it did in the amalgam procedure.
And that has like that sandpaper?
Yep, so
type
that's
feel
how
on it?
she's now,
Okay.
because you can't put those polishing
Yeah.
discs into proximally, so that's how she's polishing and adjusting the interproximal. And then you're gonna end with Mirror Explorer, so you do make sure those are flipped. And that is it, that's all she wrote. So a whole lot less involved than the amalgam
Yeah.
procedure. And again, the students last year and years past have said,